Hello everyone. I'm Dr. Abdullah Faris, head of the scientific committee in the American Academy of Developmental Medicine and Dentistry, the AADMD. And I'd like to start by welcoming you all to the first episode of our campaign, AADMD Talks. Now, throughout this campaign, we'll be interviewing specialized doctors and parents, discussing several topics, and answering some of the most frequently asked questions. Today's topic will be ADHD, or Attention Deficit Hyperactivity Disorder. We're more than honored to introduce our first guest for this episode, consultant pediatric neurologist, founder and CEO of Neuropedia Child Center, and associate professor of pediatric neurology at the Mohammed bin Rashid University in Dubai, Dr. Arif Khan. Dr. Arif, how are you doing?
Very well, Abdullah. It's a great opportunity to use your platform to send out the message regarding a very pertinent topic called ADHD.
Thank you so much. This is particularly why we chose this topic, because we want to raise awareness and spread this message to many people, because it's a very common topic that people usually have a misconception about.
Yeah, absolutely.
Okay, doctor. So we have prepared a list of questions from our followers here, between students, parents, and even doctors. So just to begin with, would you mind, in your own words, giving us a brief introduction about ADHD for those who are not very familiar with the disorder?
So, me being a pediatric neurologist, ADHD is something that I come across almost not just every day, but every hour. In fact, I end up seeing close to maybe 4 to 6 patients every day in my clinic who eventually get a diagnosis of ADHD. Now, the belief is that one physician or one doctor can make a diagnosis of ADHD, but that's not true. I have my colleagues, my team that helps me make a diagnosis of ADHD, which is a multidisciplinary diagnosis. So I get my clinical psychologist involved to do the right assessment, because as you know, ADHD is not based on a single test. It's based on a criteria that has been set by a consensus around the world. And that's how we reach to the particular diagnosis. So what is it? As the name suggests, attention deficit hyperactivity disorder, and it's a condition that affects people's behavior, to put it in simple words. And people with ADHD can seem restless. They can seem, they have trouble concentrating on a particular task, and they're very impulsive. These are three main features. So attention or concentration, you can call, hyperactivity, and impulsiveness. Not every child with ADHD will have all these three components. So that's why we have two types of ADHD. That is the inattentive type, and that is a hyperactive type. And the third type called combined, where kids have both these features.
Yeah.
And how do we reach to that conclusion? After we have applied a specific criteria to the child's assessment and then come out with the result after that. And many people think that, ADHD can only be diagnosed as a child. No, I have had many friends who were not diagnosed in the 70s and 80s. And now, when they are in their 40s, they have issues with depression, anxiety. And when they go to a psychologist, they're finally getting a diagnosis of ADHD, and that changes their life. And it's simply because in 1780s, we didn't have any awareness of this condition, and now we do.
Yeah.
So that's what ADHD is in short terms.
So moving on to our first question, this was quite a popular one. Something we see among teenagers nowadays is them diagnosing themselves with ADHD without getting a professional, just diagnosing themselves. Is this becoming more of a trend? And if so, why is it becoming a trend?
Yeah, I call it self-diagnosis. And there is a lot of, I'm sure you would have looked at TikToks and Instagrams where people are talking about ADHD and making it fun. They're putting out certain criterias and certain website links, which you can do a self-assessment and come out with a diagnosis.
Yeah.
And there is no harm in that, I think. There's no harm in having an inclination that you might have ADHD or your child might have ADHD, because you're picking up those symptoms and you're living with yourself and you're living with your kids. So you would see these symptoms and you would think to yourself, do I have ADHD? And there's nothing wrong with that. But what matters is, what do you do with that information? What do you do with that inclination when you come to know that, yes, I have some features? And what you should do is seek medical help then. So don't confirm the diagnosis on your own. With these symptoms, go to a psychologist or a neurologist or a psychiatrist and say that, look, I'm having these issues. I believe that I might be heading towards a diagnosis of ADHD. And that particular clinician, whoever it might be, will throw the right assessment tools at you to confirm your diagnosis.
Mm-hmm.
And it doesn't matter how old you are. If you think that you are poor at organization, you are very restless, you cannot focus on a single task, your mind keeps wandering, go and get yourself checked. It's just a matter of having 1 or 2 sessions with these specialists to come out with the diagnosis.
Perfect. For the second question, doctor, they asked you, is ADHD considered a disability, and can it be cured, completely cured?
No. So this ADHD is a characteristic. It's like, if I have a car like a Ferrari, I don't, but if I were to own a Ferrari and someone says, can you make this into a Toyota Corolla? You can't, because you can't, of course. No matter how good you are as a mechanic, you can't convert a Ferrari into a Corolla, because there is a underlying ethos, there's an underlying genetic makeup, there's an underlying personality or a character that a person possesses. Similarly, if you have ADHD, you're probably going to have it throughout your life. But how it amplifies and how it kind of affects your lives and others around you is something you can change.
And deal with it.
Correct. That you can change. And that you can change by identifying early and getting help. Mm-hmm. So you cannot cure ADHD, but you can definitely help people with ADHD so they can kind of amalgamate and get used to get into the society very easily. Exactly. Your other question, is it a disability? It's an excellent question, whoever has asked that. We need to understand what is a disability first. So disability is any condition, whether body or mind, it doesn't matter, that makes it more difficult for an individual to do certain activities, which I call as activity limitation. And also they struggle with interaction with the world, which I called as participation restriction. So if any of your conditions lead you to have these 2 problems or one of these 2 problems, then it's called a disability. ADHD, if I am a doctor, I see a child, say, who is 15 years of age, and I diagnose them with ADHD, if that ADHD is affecting this child's participation in the society and restricting this child's activities and needs some help or some adjustments or adaptations to go into society and start working and learning and all that, then it becomes a disability. Mm-hmm. So not every child with ADHD has a disability. Some of them might be just having a mild form and they don't have any problems with their daily activities and participation. But in some kids, when you classify that they have these issues, it can be called as a disability.
It all goes back to what you mentioned at first. It's how you cope with it.
Absolutely. Absolutely.
Okay. Yeah. So, doctor, for our next question, this was also asked a lot. Is adult onset ADHD a real thing?
It is absolutely. I don't think so. It's an adult onset. I think it's an adult presentation of ADHD. So as I said to you, in 80s or 70s, these diagnoses were not made. I have seen a number of adults, my own friends who are in their late 30s or 40s, who have been diagnosed with ADHD now because they self-diagnose. They pick up these symptoms, then go to a psychiatrist or a psychologist and say, look, I'm not good at organization. I have time management problems. I cannot focus on a task. I keep interrupting others and my family. My wife doesn't like it. I'm divorced twice because my wife's kicked me out of the house a couple of times. And when they mention this, then you think, oh, wow, have you looked at this? And then you throw an assessment at them and they get a confirmation of ADHD. No matter how late it is, if you can find it out, you can get specific recommendations and sometimes medications to help improve your ability to focus and pay attention.
So it's not an adult onset. It's just that they discover it. They discover it late.
Correct.
Yeah. Okay. This one is for the parents. If I'm a parent and I have a child that has been professionally diagnosed with ADHD, what are some things that I should keep in mind when dealing with my kid?
Yeah, it's a very generic question because every individual's recommendations differ.
Yeah.
So, for example, if a mother has a 6-year-old boy who, because of ADHD, struggles academically. That child might have many problems, like waking up early in the morning and brushing and changing their clothes and going. That activity sequences the child might struggle with. So what I tell parents is just make a sequential chronological flow chart and stick it on the fridge. So child knows when he wakes up, he has to just follow them. And these kids normally, they follow visual cues very easily. So if you have a visual cue or a calendar or a flow chart stuck to the wall, and they know they have to go and look at this and all the sequences will be put into play, they will stick to it better. Secondly, when they go to school, if a child is not paying attention and focusing and they're sitting at the back of the classroom, obviously it will not help them. They have to be made to sit in front, where they can have at least a direct observation from a teacher. Giving them slightly extra time in your assignments and tests, because many a times when they're not given any extra time, they fail to complete their test. No, even if they are intelligent, they're cognitively very good with good memory, they will not perform in an assessment as good as a child who doesn't have ADHD, simply because while doing the test, they're focusing elsewhere and they cannot complete the task. Give them that extra time. That will build their confidence. That will help them improve their skills. And when the child comes home, you're tired. The child is having more energy left. So they will be jumping and screaming and creating chaos at home. Parents should understand that, yes, my child has ADHD and they have this extra energy to expel. Take them out, take them into a playground, get them into extracurricular activities, get them into sports or swimming. And these kind of things gives them a platform to bring those excess energy out. So these are some of the tips that parents can use to help kids who have been diagnosed with ADHD.
Perfect, doctor. So for our last two questions, they're somewhat related to each other. First, is it okay to stop taking ADHD medications at a certain point? And if so, when?
Absolutely. So, I start children with ADHD, not all of them. Some kids who have a significant level of ADHD, I start them as early as maybe 5 or 6 years with medication, depending upon what type it is. We choose which medication to use. There are stimulants, there are non-stimulants. And I tell parents that, look, when I start medication, I'm giving your child certain help or time so that their brain or mind learns how to focus, because their brain and mind is quite naive, quite new to focusing or paying attention. They don't know what it is. So once I start medication, it's like giving time to their brain in those 12 hours a day to help them focus better. And as they keep doing that with the help of the medication, they will develop their own ability to focus and pay attention. So some kids of mine, after 3 or 4 years, we take the medication off and they don't need it after that, because they have developed their own skill of paying attention. Paying attention or attention is a skill. And some kids don't have it because they get distracted very easily.
Yeah.
And with time, when you teach them that with the help of medication, their mind learns that. And after a few years, you can take the medication off. Yes, in some cases, they might have to be on it for a long time, and sometimes take that into their adult life as well, because they have a significant level of ADHD within them. But it differs from one patient to another. But your question, can it be taken off? Absolutely, the medication can be taken off.
And for our last question, what are the consequences of untreated ADHD cases that don't seek treatment at all?
Yeah, I have, again, as I said, I have a lot of friends who did schooling with me, did college with me, who had ADHD, but they were diagnosed in their 40s or not diagnosed at all. And you can see them. I mean, they are very clever people. There is no issues with intellectual ability or cognition or relationships, or some of them are engineers, some of them are policemen, some doctors even. But what happens is two main issues. When you have ADHD, you tend to have comorbidities sometimes. You can have anxiety, you can have depression, and because how the society sometimes accepts you or doesn't accept you, that can lead to suicidal tendencies and so forth. Many kids with ADHD who are not picked up and not treated become juvenile delinquents. They leave school and they get out of school and do things. They get into drugs and alcohol and so forth. And that happens because throughout their life, nobody has understood them. They were not able to focus on, look, I just wanted you to see this cycle. They were not good at studies because they couldn't pay attention. And people didn't realize that. And they were thinking they're just naughty and they don't want to focus on studies. And they went on to perform poorly in exams. They were not clearing their levels. They were behind. They ended up being with kids who are younger than them. And socially, they were deprived of that. They became demotivated. They decided, okay, let me leave school now. and they jumped out of school, started doing things that do not require attention, bullying others or getting into some kind of antisocial activity. When the police catches them, gets them into jail, even further stigma, social stigma. The family disowns them. They go and start doing the wrong things on the street, become an independent. It's a cycle. It's a cycle. So kids having ADHD should be diagnosed early. They might not need treatment, but they will at least need right recommendations, and the school can implement that to help improve this child's trajectory moving forward.
Okay.
I just want to tell the audience that if you want to understand some of the short clips or understanding about ADHD or even autism for that matter, epilepsy, any neurological condition, I would direct your audience to my Instagram. And I have made videos there, which they can have a look at. It's dr.arif.khan. And just go there and have a look at some of the videos if you're interested in a specific topic.
For sure. Thank you so much, Doctor. Thank you so much.
Pleasure. Thank you.
By this, we conclude our first episode. I'd like to once again thank Dr. Arif Khan so much for joining us today and answering all of our questions. Dr. Arif, we hope to see you again very soon. And thank you so much for attending. Thank you everyone for watching and listening, and stay tuned for our upcoming interviews. Thank you.